Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest technology trends and interesting stories in health IT. Today, joining me on the program, we're going to be talking about an interesting migration to the cloud. And joining me is Jesse Burke, Director of IT for HealthWorks for Northern Virginia. Jesse, welcome to the program.
Thank you for having me.
So Jesse, before we dive deep into your cloud journey, maybe you can tell our audience a little bit about your organization.
Of course. HealthWorks for Northern Virginia is located in Northern Virginia, and we are a federally qualified health center. Many people don't know what a federally qualified health center is, but it is. I didn't know it when I started, but basically it just helps lower income patients get it, because we're not like Toronto where it's a universal healthcare. But we see about 40,000 patients per year.
Wow.
Last year was 7,500 roughly new encounters. There was about 70% actually are Spanish speaking. Yes, so you do that. And our uninsured patient population, which self-pay, which is why an FQHC exists, is around 65%. And we are located actually in Loudoun County, the actually wealthiest county in the nation, and our other sites is Fairfax County, which is the third wealthiest county in the nation. So people ask us all the time, why? Like, what do you do?
Why
is there a low income there? Like, because there's people there that you don't know about. And so those people come to us for that, and that's kind of what we want to make it easy for them to do. And so that FQHC actually provides dental, behavioral health. We're opening up a radiology clinic here shortly. Discounted meds, basically just a discounted program for all the people, and that's kind of what that's our bread and butter there.
Right.
So we are not in it for the money. The providers there, they're great. They can make a lot more money, especially in that area, doing something else, going to private practice. But they decide to not. And it's a lot stressful too. I mean, it's way stressful. So, but I'm glad I'm working there. That's why I've been there for about 5 years, and I've seen it grow. We've seen it in the past 2 years. We've opened up 3 new clinics actually, a new dental site.
Okay.
And yeah, we're continuing expanding.
Nice. And it sounds like a very multi-specialty approach to your community, which is what they need.
Yes.
So I want to dive into getting your perspective on the migration to the cloud. It's not often we get a chance to talk to people who have done this migration, have gone through it. So I'm very excited to have the chance to sit down with you. But maybe take us back a little bit. What were some of the business drivers or operational drivers that even got you thinking that this was a project you wanted to take on?
So we are a little more unique than other places, meaning the situation that we were in, it forced us to kind of go. So there is a care community network,
okay,
and they're located, many states have them. And at one point when the Affordable Care Act and all that kind of pushed people to go towards EHRs and forced them to go there, these care community networks, they popped up, they go, hey, we'll do all your IT service stuff. And so we'll be located, we'll take all your stuff and take that burden. And so a lot of FQHCs, they were like, hey, we'll do that. So we were locally hosted on-prem, but it was still kind of cloud to us.
Right. So it was a third party, but
it was a third party.
Right.
But that third party at one point decided they were not going to be that, and so they outsourced it to another party, and that party that outsourced it to that another server, actually somebody specialized. So the place, say I wanted to access a server, I would have to place a ticket with eClinicalWorks. That help desk would have to reach out to our care community network help desk, and they would have to reach out to the server, and then they would have to reach out to their specialty people that took care of eClinical. So there's 5 people just to get access to one thing. They also switched to Linux for some reason, we don't know. But that wasn't the key. Like, it was slowed us down for about 2 weeks. I mean, we were shut down for about 2 weeks. Like, and at my time as the boss, we were migrating to another practice. We were actually inputting another practice, and like there's no way we can do this. I was like, so we were about 5 months out, and we were able to get it migrated over within, I think it was like 2-3 months. All that thing was set up very quickly because I asked eClinical, I said, hey, give me the, I was like, we're migrating soon, like, and there's no way we can do it because once again, one ticket, 5 people. Can you imagine an entire project that is 10, 15 people probably. So we basically, that's the reason, that was the biggest driver. And I was like, hey, like it's gonna cost more upfront at first.
Sure.
But we're losing business already. We can't practice because of this area.
So it sounds like one of the big drivers was just control. Like, instead of going through to 5 parties in order to get access to the server, by hosting it, by moving to the cloud, you're now in more direct control of your systems.
Yeah, it sounds weird. When you go to cloud, I got more control, but yeah.
Interesting. So can you maybe give our audience 2 specific examples of something that's maybe easier to do now or possible now that wasn't possible before?
Yeah, so placing a ticket or any kind of going to a help desk is so much easier now because it's just one party, me, and they're talking to me, and I'm talking to them, and it's just, we can connect easily. Before it was multiple parties. So this is kind of the difference that a lot of people have is that when they host, they're on-prem. I like that word I used earlier. So I'm gonna keep saying it. It's that they hosted their own, so they had their own IT network. We didn't have it. We just basically just went out to them. We have a third-party IT vendor that helps us out, but so it was a little different. But it was easier when we actually went to ECW Cloud to actually just place a ticket, because before it took forever.
A black hole, it sounds like.
So basically, it was trying to get a help desk to call a help desk, and that help desk to call another help desk, and then that doesn't really work out sometimes because they're like so that was one of the big factors. And then the other one is accessibility. So my IT team, so we have about 176 employees roughly, 30 community partners, and then some labs, and it used to be, I used to have somebody else, so it was just me and him as IT. That individual's gone, so now it's just me for all those 170. Of course, and being an FQHC, we have to live off of grants, so
you got to be resourceful.
Yeah, so my team consists of. We just had a great meeting the other day. It was myself and I, and me, and we're just, let's just cut this agenda meeting. But no, so it's just me. So that is kind of benefiting me, is that this is paying for itself, basically, because we're not paying as much if we had actually to do it. But accessibility and the ticket process, yeah.
So you mentioned it earlier. It sounds like the transition to move to eClinicalWorks Cloud was pretty quick. I mean, it sounded like it was only 2 to 5 months that you were done moving from your old systems onto the new one.
Yes, yeah, and I asked. I was like, is there somebody that has experience with this? I had good contacts with eClinical because I've been working with eClinical since roughly 2015. Not with this practice, but with another. And so I had some contacts there, and they said, hey, come here, and I'll get you this guy. And this guy, he was stressed out, so he was a good practice manager. Project leader, because he was like, oh, I don't know what's going on. And he knew what was going on, but he's great, and he got it done within a month. Not even that. He got it together, and then he was the same project manager that actually migrated us to another place. So
was there a lot of upfront planning? What helped make it? I mean, it sounds like he was amazing, but was there other things that you did to help make that transition really smooth?
Well, it was actually all, so eClinicalWorks, they've actually updated their help desk, their dashboard. So they actually have an implementation dashboard here. And so everything's now online. It's not like they would send an Excel spreadsheet and be like, hey, here's this, here's that. And you're like, I don't know who has access to this. Can we give access to this person? If somebody needed access, you can just make a username. But so
Gotcha.
Everything's on that, on their dashboard there where you place a ticket. And so to migrate, they would have it all there, and you would go, yes, there, yes, that, English to English, English to lowercase English, and so everything mapped out well because it's all basically on this kind of portal base it did. So it was very easy, very smooth. Yeah.
So now that you're on the eClinicalWorks cloud, is there something that you're really excited about that's now going to be possible for your practice going down the road in terms of future technologies or future implementations?
Oh, definitely. So one thing also is, when you would have to update anything, you have to kind of place another ticket. You're like, okay, let's work with it and get it. And that could take, people are busy, so it's gonna be like, okay, we'll update it. We'll get it later. We'll get it later. But now it'll keep it. Now it's just automatically. Now it's just let it go. They have these little documents that come out that say like, oh, hey, if there's an update to the NDC code or update to your drug database, and it goes, yeah, you're there, and it goes in the very corner. It's like, if you're on eClinicalWorks Cloud, you don't have to worry. It's already done.
It's already there.
Oh. I was like, well, I don't have to worry about that anymore. I don't read many documents anymore now. It's like, they did it. Yeah, that's cool. That's cool. Of course, then if they don't do it, and then I place a ticket and they have access to the server now. So easily they go, I'll go check it out for you. Thank you.
So if you were talking to a peer of yours at another organization that was thinking about implementing something either on eClinicalWorks Cloud or moving to it, maybe was in a similar situation to what you found yourself, what would you say to that person? How would you advise them?
I would tell them, well, first of all, good choice, and you're making the right choice to go to the cloud because everything is going there. Nobody wants to have. Before you had to. A good example would be email. Email before you had to delete emails. Now you don't have to delete emails at all. You just archive it. Just like, it's up there. It's going there. You don't have to. Make sure you save it. Make sure you save your documents. Microsoft Word, you can save it. Now it's just automatically saved every time. So that is the benefit of it, is that it's going to be, they update it, they do all the work for you on the back end, and you don't really have to do much. You can see it. And the advice would just be, get it done as soon as possible, because there's no reason to not do that unless you are a cloud-based company. Then obviously don't go to cloud because you're a cloud.
It still is amazing to me that you're supporting that many people, and you're an IT team of one, and that's only possible by being on the cloud.
So that is also another thing, is that I don't have to watch a VPN list. I don't have to be like, oh, is this person still viable? And so do I have to make them a username, get into the VPN? This is also one of the greatest things was for the community partners. So we work with like the county, we work with a phlebotomist, all of them. All I have to do is give them a URL and do two-factor authentication. I'll make them do Google Authenticator. They do it. Nobody's had complaints. And anybody that needs any kind of access, I can get it like that, and it can take away access like that. I can make it so it's time-based, IP-based, and so. But I usually just do the two-factor authentication.
Sure.
But that makes it. I just gave him I gave him a packet that I created back when we moved to the cloud in 2019, and that packet hasn't changed. And so they're like, here you go. And then that's how I can do that, and not have to be like, oh, let me check on this, let me check on that, and it's great. So
amazing. Well,
and physicians can access it anywhere. So as long as they have access to the internet, they can access it.
They can access it. So they can do some of the stuff at their home office if they need to. They can be at various facilities and still get access to all the records that they need to get by just logging in anywhere with their browser.
Yes, and this happened before COVID-19. And so we just kind of lucked out there, because then they could do it because they did telehealth.
Sure.
So we did telehealth, and it was like that. So some people are like, oh, my laptop is broken, because laptops break. And obviously we couldn't get it to them in time. And so they're like, well, how can I use my at-home computer that has a microphone and camera? Yeah.
There you go.
Here's the URL.
And now because it was cloud, it was so much easier.
It's just like that. Yep, use Chrome and you're good to go. Or now Microsoft Edge uses Chromium, but yeah.
Amazing. Jesse, thank you so much for all the information you shared. I'm glad your cloud journey was so successful for you and your organization.
Me too.
All right. Well, before we go, where can people go to find more information about your organization?
They can go to www.hwnova.org, or you can just Google HealthWorks of Northern Virginia, and it'll be there.
Thank you so much, Jesse.
Thank you, Colin.
This has been Colin Hung with Healthcare IT Today. And if you enjoyed this interview as much as I did, we'd love for you to go out to our website, healthcareittoday.com, to check out more great content like this. I'll catch you on the next video.